Good evening, everyone. The science and grim projections that just weeks ago brought this country together against a common enemy are under fire tonight, along with a doctor who has helped lead the fight against coronavirus. President Trump tonight rejecting Dr. Anthony Fauci's dire warnings against reopening the country too soon. The president late today suggesting schools could reopen soon, even as we learn kids may be at more risk from COVID than previously thought. While Fauci himself, who has predicted many more Americans will die, came under a broad attack. And that's where our reporting begins with Jeff Bennett.
President Trump tonight slamming the stark warning from Dr. Anthony Fauci against reopening the country too soon.
Look, he wants to play all sides of the equation. I was surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer, especially when it comes to schools.
During Tuesday's Senate hearing, Dr. Fauci was asked whether colleges and schools could feel safe welcoming students back in the fall. He said that would largely depend on the availability of testing. Fauci's call for caution clashing with the president's push to lift restrictions, fueling growing fatigue among some Republicans.
I think it's very important that we not let any one person dictate what we do in the economy.
It comes as yet another top government health official is set to deliver a different dire warning to Congress about the coronavirus crisis. Ousted vaccine expert Dr. Rick Bright set to tell a House committee tomorrow that the U.S. faces the darkest winter in modern history if it does not develop a more coordinated national response to the pandemic. Dr. Bright filed a whistleblower complaint last week, alleging that he was forced from his job for opposing the wide use of unproven coronavirus treatments embraced by President Trump. His comments coinciding with new reporting from the Associated Press about the CDC's reopening guidance, which was shelved by the White House. The AP reporting that the recommendations were much more detailed than previously known, offering states specific guidance on when communities should allow for non-essential travel and recommendations on when to shut down again in the event of future flare-ups of the virus. The White House said the document had not been cleared by CDC Director Dr. Robert Redfield.
Those are guidelines in draft form that a rogue employee has given you.
But the AP reports that internal emails show that Redfield did sign off and repeatedly asked the White House to approve the release beginning more than a month ago. Meantime, word tonight that the rapid coronavirus test from Abbott Laboratories, which the White House uses to test the president and those around him, may miss as many as half of positive cases. That's according to a new report from NYU Langone Health. The company is disputing the findings, saying the outcomes in this paper are inconsistent with any experience that we've had with this instrument. The FDA telling NBC News the agency is reviewing the NYU report. And tonight, former Trump campaign chairman Paul Manafort has been released from a federal prison due to coronavirus concerns and will continue serving his sentence for tax and bank fraud and home confinement, although there are no known cases of coronavirus at the prison where Manafort was held. Lester?
All right, Jeff Bennett, thank you. And as the battle rages over schools, even between the president and his own top medical advisor, there's news about that mysterious inflammatory syndrome striking children. It's now in at least 17 states. Kristen Dahlgren has the latest.
In Oregon, a state with one of the fewest numbers of coronavirus cases, 14-year-old Leah Lopez didn't know what to think when she developed red eyes, a fever, and searing abdominal pain.
On a scale of 1 to 10, it was probably like a 10.
By the time she got to the hospital,
she was in fairly severe cardiac failure.
Leah didn't know anyone with COVID-19, had been careful herself, and is now one of a growing number of kids with pediatric multisystem inflammatory syndrome. She tested positive for COVID antibodies.
What it makes us realize is that it can happen to any child at any time, and we need to be prepared.
As cases surged today to more than 80 in New York City alone, the mayor announced a new ad campaign to alert parents. While the governor said New York is now prioritizing tests for children showing symptoms of the inflammatory syndrome.
If your child has been exposed to someone who had COVID, even if it was several weeks ago, that is a special alert in this situation.
3 children have died, and the syndrome is now suspected in 17 states. It's still rare, but experts have shifted their thinking about kids and coronavirus.
Coronavirus isn't a benign condition in kids. We need to figure out what that denominator is, how many kids actually had coronavirus.
By tomorrow, the CDC is expected to issue a national alert to doctors to look out for symptoms, including prolonged fever, rash, red eyes, and abdominal pain. Most children seem to respond to treatment. In New York State, more than half have now gone home, including Jaden Hardawar, who got a warrior send-off. But tonight, their stories may be a warning for what other children could face in the weeks ahead. Kristen Dahlgren, NBC News, New York.
Tonight, another big-name school is announcing that some in-person classes are already canceled for the fall, and many parents and young people are left wondering what's going to happen to their schools. Here's Gabe Gutierrez.
Tonight, Harvard University is telling its new medical, dental, and graduate students that classes will be online this fall after the nation's largest public university system, Cal State, called off in-person classes at its 23 campuses. Across the country, higher education is now facing a reckoning.
It's confronting not only the challenges that the virus presents, but broader issues about things like affordability.
Still, a new poll shows 65% of college students say they would attend in-person classes this fall if given the option. 31% say they would only attend virtually. That means despite the risks, even with potentially packed lecture halls, students clearly prefer a more traditional in-person college experience, not a virtual one. Annie Colson is a theater student at NYU.
It is so important for me to be face-to-face with all my teachers and my peers because we're all learning off of each other and we learn so much more in person.
As of now, the vast majority of colleges, 70%, are planning to resume in-person classes this fall, though life on campus will likely look very different. Pace University in New York is still grappling with the decision.
What we're looking at is changing the way we live, we work, and we play and study.
Also at stake, money. Nationwide, 345 private colleges and universities are at risk of closing or merging over the next several years. And this year, fewer high school seniors have applied for college financial aid, a sign coronavirus may disrupt enrollment. Lila Robinson from Ohio is a psychology major at McGill University, which will only hold online classes this fall. She's devastated.
Just anxious because you don't know how long this is going to last and what's going to happen.
A senior year unlike anything she ever expected. Gabe Gutierrez, NBC News, New York.
From beaches in California to stores in Ohio, more of the country reopened today, even as cases are still climbing in some areas and tempers are flaring. Here's Miguel Almaguer.
As more of the nation reopens today, there is caution, confusion, and concern. In states like Arizona, pools, spas, and gyms got back to business with restrictions.
So thrilled and excited.
In Ohio, more retailers were back on the job, while in Oklahoma, they're rolling the dice on gambling, reopening casinos.
We're taking temperatures at the door. We've limited the amount of guests that can come into the facility.
But some worry the push to make money comes at the cost of public health. As restrictions are being lifted, new hotspots with significant spikes in coronavirus cases are emerging in the heartland. The staggered reopening of the nation sparking dueling protests to both speed up and slow down the push to get Americans back to work. In Fresno, California, a city councilman cited for misdemeanor battery after this confrontation with protesters on his porch. In Los Angeles, the concert season is canceled at the famed Hollywood Bowl for the first time in nearly a century. This is 25 miles of coastline reopened to the public today with new rules.
I was a little bit nervous, but I'm glad we did it.
With LA's most iconic industry shut down and no plans to start production anytime soon, some are ready to begin filming elsewhere.
In Georgia, where there's also a mixed bag of restrictions, Tyler Perry Studios will reopen for production in July, testing and sequestering cast and crew for the filming of 2 shows. But tonight across most of the country, the script is unwritten over reopening as more drama plays out. Miguel Almaguer, NBC News, Los Angeles.
Tonight, the FBI is warning that China is jeopardizing the development of a vaccine by trying to hack American research. Richard Engel has more.
China is trying to steal U.S. coronavirus research, the FBI announced today, by hacking scientists and companies, including those working on a vaccine. That warning, also coming from the government's top cybersecurity agency, says China's potential theft of this information jeopardizes the delivery of secure, effective, and efficient treatment options. American secrets aren't the only targets. The UK, where Oxford researchers say they hope to have a vaccine ready by September, is also seeing attempted hacks. I had a rare interview with the head of the cybersecurity division of GCHQ, the British equivalent of the NSA.
They're attacking different targets. So the nation states are moving away from perhaps things like energy companies towards strategic healthcare targets, towards university researchers into COVID vaccines.
The Trump administration is singling out China, specifically, by name. You are not going there. You're not saying China per se.
The UK and the US share a common picture, a common assessment of the threat.
China is not the only nation accused of cyber espionage. Iran reportedly tried to hack into the company that makes the drug remdesivir, which was granted emergency authorization for COVID by the FDA.
Tonight, U.S. authorities are advising healthcare companies to beef up their defenses against hacking. China and Iran deny the allegations.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.